Hello, Ellen Suarez here, district nurse, and I'm here to explain an overview of adrenal insufficiency and the emergency treatment for a student with this health issue. So if you look at the handouts and you can scroll down, it gives you a definition. So it's a chronic medical condition in which the adrenal glands are unable to produce adequate amounts of both cortisol and aldosterone. So usually aldosterone too, to maintain the body's normal function. So it's usually diagnosed shortly after birth, and they will present with some initial symptoms, and we'll go over those in a little bit. Physiology on the next page, aldosterone, it helps with sodium and fluid balance. It's a mineral corticosteroid. So sodium and fluid balance are involved in maintaining the blood pressure. So when you don't have this balance, blood pressure problems can happen. Cortisol is your stress hormone, and this controls several issues in the body, or several functions in the body. It helps with blood pressure, but also with glucose maintenance, so keeping your blood sugar within normal range. Metabolism, so how fast you use up carbs and for energy and growth, and then your immune function. So if you go on to the next page, page 7, it talks about what happens when a student with these with this health issue happens when they become stressed and they don't have the stress hormone. So students with these issues do take maintenance cortisol at home. So they take a tablet. So they'll take a tablet in the morning and a tablet at night. And so they have to do that ongoing all the time, every day, no matter what, in order to give themselves the maintenance. Unfortunately, there are stressors in life that will stress their system above and beyond this maintenance dose, and they will cause them to go into a crisis. So insufficient cortisol production reduces the body's ability to respond appropriately to stressors. So the liver is unable to metabolize carbohydrates properly, so their blood sugar can drop out. And vascular smooth muscles become unresponsive to epinephrine and norepinephrine, which are in our body. And so vasodilation and capillary leaking occur. Adequate blood pressure cannot be maintained, and the blood vessels may eventually collapse. We don't want them to get there. So that's why we respond in an emergency situation. So we're going to talk about symptoms. So if you go on to page 8 and the second box on page 8. So here's signs and symptoms that there's a crisis happening. So a lot of times it's their skin color. So their skin color will become pale. They'll feel nauseated, feel like vomiting. They'll be weak, lethargic. Their tissue, hands, face can be cold and clammy. So then the pale skin color, their body temperature can be lower. Their heart rate is going to go up because their heart is trying to compensate for the drop in blood pressure, so the heart will beat faster. Their breathing compensates too. They're going to breathe faster. Dark circles under their eyes. So that can happen when they don't have enough cortisol. Severe pains in their stomach, legs, and back. Dizziness, confusion, fainting or passing out, and signs and symptoms of dehydration. Doesn't sound like a good picture to me. So we need to act fast. We have about 4 students in our school district that have adrenal insufficiency. So even overexertion, like playing sports really hard, can cause a crisis response. And so when they're doing a lot of profuse sweating and very high calorie output activity, they can trigger this crisis response. So in that, so also things that would be, so those are the symptoms, but things that can trigger those symptoms would be, say, a head injury, a hard fall, A broken bone, especially a larger bone like the humerus or the femur, or even the tibia or fibula in the lower leg. So those kind of injuries can trigger this emergency response. Repeated vomiting and diarrhea, especially at the same time. So you're going to have that drastic fluid depletion. And so then the body can't, their bodies cannot adjust quick enough to maintain blood pressure. So each child varies in their rate of deterioration. It just depends on their resilience, if they took their maintenance cortisol, and just how they respond. So each student would be different. Rapid deterioration, you can have organ failure, shock, coma, and death. We just don't want to go there. So these students are maintained and followed in the endocrinology clinic at Valley Children's. And so we do get specialized orders. So also high fevers. High fevers can be a stressor to cause them to need their emergency medication. So with the orders, we do get a description of what signs and symptoms to look for. And then we have the dose, the emergency medication dosage for each student, because it's based on weight. So it's called Solu-Cortef, and on page 10, you have a picture of that. And so it shows the little vial, it shows the box. So right here's the box, and I don't know if you can see that. Oh, there we go. That's pretty focused. Solu-Cortef. And so it comes in a vial that needs to be reconstituted. And so this vial has saline at the top, and then it has the Solu-Cortef in the bottom. So it has to be mixed just before administration. You can't mix it in advance, tuck it in your back pocket, and carry it for later. It doesn't work that way. So with this medication, it has to be, so it has a little tab on the top. So it looks like a little bullseye circle that you have to peel off. So you take that off. But before you do that, you're gonna wanna push on the yellow portion. And so there's a little cork, a little stopper in between that, between the top and the bottom. And so that keeps the fluid and the powder from mixing. So you're gonna want to put it on a firm surface, push down on it, and you're gonna pop that cork down, and then the fluid will run down into the powder. Then you gently swirl it, and you get them to mix. Then you're gonna take up the syringe, and you're going to take the same amount of air that you want. So if you want 2 cc's out of here, you're gonna take the 2 cc's, and you're gonna inject it into the top, and then it will automatically, you pull it up, it will automatically start going into the syringe. Okay? If you are to take a student on a field trip, one of the district nurses will meet with you and help you practice. We do have stress balls that you can inject the medication right into the stress ball. So it's a practice, like you're going right into their deltoid muscle. So they can take off their shirt, and they can, you can give it right here in their upper arm. And those instructions will be just before you travel. Safety, so make sure that you have communication with the parents. Make sure that they know when you're going to travel out of the area, where the field trip is. Make sure, and then we have to make sure that there is, that everyone knows that this student has this health issue, and then the training happens, and you are to check out the medication from the LVN at your site by going and signing on the field trip log. So they will put the Solu-Cortef, student's name, date of birth, medication, Solu-Cortef, the checkout date. And so you will need to initial in that box with your full signature at the bottom of the form before you take it. So anyway, and then also include a juice or two, so that if their blood sugar is the issue, that you automatically bring the blood sugar up. So you would want to give them a juice and see, that could be the problem. So we don't have glucometers for these students, so we don't have a way to check their blood sugar, but you can give them a juice and see if they respond, if the perspiration, on their face goes away and they don't feel dizzy, lightheaded, or nauseous, then that was the issue. If you are familiar with the students, we make sure that those in the school setting are familiar with which students have these issues. And so the doctor's orders do serve as a treatment plan because they are comprehensive as far as giving background and giving symptoms and then giving treatment. On page 12, so it gives you the list of things to be included for the emergency bag. Your site nurse will help with that and make sure that you have everything that you need and everything that you need to know for your travel. So thank you for watching this video.